Hello, everyone. Welcome to Dean's Chat, where we talk about all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. I'm joined today by my co-host, Dr. Johanna Richey. Hi, Johanna.
Hi, thanks for having me.
Oh, thanks for being here as always. Dr. Richey and I are going to introduce our guest, Ellie Nasser. Dr. Ellie Nasser is from the Geisinger Residency program. We are so pleased that you joined us. Thank you.
Thank you so much for having me, and I appreciate the opportunity, and I'm excited for the conversation.
Fantastic. Well, Ellie, we go by kind of first name basis here on Dean's Chat, so if it's okay with you, we'll go Ellie, Joe, and Jeff. How's that sound?
Perfect.
All right, thank you. Joe, take it away.
Awesome. Well, Ellie, thank you so much again for taking time out of your day to come talk on Dean's Chat about the program and some of your experiences. From the day that I met you, your positive energy and professionalism completely lit up the room, and I just think that you're a rock star. So I just will start your intro with kind of at the very beginning. So you did your undergraduate degree in biology and theology at Boston College, and then you completed your podiatric medical school training at Temple University in 2010. Then you went on to do a 3-year surgical residency training program at the Geisinger Community Medical Center. After that, you completed a fellowship program, which again, we're going to definitely want to get some information from you about that experience. And your fellowship was done at the Northeast Region Foot and Ankle Institute, and its focuses were primarily in limb salvage and reconstruction. You've got a very extensive CV. You've volunteered your time for a myriad of professional organizations, including the American College of Foot and Ankle Surgeons, the American Board of Foot and Ankle Surgery, Journal of Foot and Ankle Surgery as a section editor, the American Podiatric Medical Association, and the CPME. You're currently one of only a few female residency directors, and you're currently the residency director at the Geisinger program in Scranton, Pennsylvania. So let's start with that. Tell us a little bit about your program. How many residents do you guys accept?
Thanks, Joe, for the kind introduction, and I will echo the praise from when I first met you. The energy is equal. Thanks for bringing up our residency program. So we are a large residency program. We take 5 residents a year, and we're part of a large healthcare system that is based throughout the state of Pennsylvania. So our main central hub is in Northeast Pennsylvania, but we have campuses throughout the state, and we do some rotations at these different campuses throughout the state. I'll keep going a little bit about the program. I like to brag a little bit that we're a really well-rounded program. We have all the different pieces. And so there's programs that are very heavy in just surgery, or very heavy in just research, or just clinic. And we check all of those boxes, and we check them very well. So we do a lot of reconstruction. We have a heavy emphasis in limb salvage, especially Charcot. We get our residents come out with experience in external fixation. We have resident clinics. We just started in the past year a resident-run post-op clinic that our third-year residents are doing. They love that. They love the autonomy. We have a wound care center. We do a lot of inpatient work. We have trauma, and we have a really great research program and academic program. It's very structured. I like organization. I like when the residents know what to expect, and so we meet every Thursday for 4 hours. We rotate with different hands-on labs and sawbones and cadaver. We do journal club and M&M. We always review any pertinent and important cases for the upcoming week. And then we'll do like a radiology rounds recap of cases that had already happened. And we do these research meetings once a month. So we have a whole support system within our institution and within our orthopedic department. So we have a statistician, and we have other research support that help the residents with their IRB proposals, help them create their posters, help get their posters printed. And I'm really proud to say that we present every year at APMA, every year at ACFAS. We're getting everything ready to go later this month, actually, to Tampa, and really get the name of our program out there and show some of the exciting research that our residents are doing.
That's awesome. And I know that's definitely usually a high question I'll get from students is, they want to know, they don't know what they want to go into yet, right? Like, I don't know if I want to do just trauma, or if I want to do reconstructive stuff, or if I want to do wound care. And so usually the best advice that I think we can give is if you don't know yet, which I think most of the time students don't, like, how could they? Then go somewhere that you can get a collective experience, a lot of different opportunities, because then you'll start to feel out if there is one little area that you want to maybe focus or consider something like a fellowship. If you realize, hey, I really love sports medicine and I didn't even know I'd love it, or I really love trauma and I didn't think that I was going to.
Yeah.
On that note, thinking about your experiences with your fellowship, can you talk a little bit about what fellowship was for you, why you chose to do it, what your thoughts are about fellowship in general?
Yeah. Thanks for that question. And I, as a residency director, I get it very frequently. Every year, the second years are debating, is this something that I need? Is it something that I want? And for me, it fulfilled a role of transition. So I felt like I was half an attending and half a resident. And I had a lot of independence and autonomy, but I also had a phone a friend if I ever needed help or if I ever needed anything. And I would say the most important thing it gave me was confidence. I came out of residency with really good training and really good surgical skills. And I did develop that more. But I think more importantly for me was the confidence that I built in that transitional role. And so I always caution residents to think about why they're considering a fellowship, and to never consider that because of what they think that job outcome might be, because that might not be different. Just because you do a fellowship doesn't necessarily mean you're going to have, end up with a different job or end up making more money. It can open the door to different opportunities and research and making connections and building relationships. But I always encourage them to think about why it is that you want that. And is it a void, like you mentioned, or not even avoid? Maybe you just love this one particular part of your training and you want to do more of it. That's fantastic. I encourage that. If it's maybe you did come from a program that lacked X, Y, or Z, and you found a program that can focus on that in fellowship, that's fantastic as well. But for me, I think that the biggest benefit I got out of it was improving my confidence.
Thank you. Go ahead, Jeff.
Well, we hear that over and over, right? That competence-confidence equation is so important because as a resident, you've got 15, so you've got 5 per year, Ellie. You're sharing the big cases and things. You're not always working up the patients from the beginning to the end and follow-up. So I think that's a common theme with fellowship, and thanks for sharing that.
For a typical day for your residents then, how does that kind of flow for them in the hospital in terms of, you had mentioned multiple medical centers that you guys are kind of affiliated with. How do they kind of structure? What does like a typical year kind of look like for first, second, and third years?
So we have everything set out as our block schedule and rotations in advance. So our residents will know when they're assigned to different campuses. We have one sister campus that's 20 minutes away, and we'll have a designated resident there rotating every month. But then we have a campus that's near State College, near Penn State. We have an apartment there. And so the residents will spend 1 month there in their second year and 1 month there in their third year. And they know that in advance. They know when that's going to be. They love that rotation. They are the only resident out there. And they, get a lot of autonomy. They get a lot of billing and coding. We just created, this is our second year of a billing and coding curriculum that one of the State College physicians put together. So pretty cool for our profession. I don't think many residencies in podiatry include a billing and coding curriculum in their program. So they're getting that there. Most of the rotations are local to our hospital and that sister hospital. And so we're hitting all of the CPME requirements of emergency department and infectious disease and that list that every program has. And then we do a lot with orthopedics. We have a great relationship with them, and we're scrubbing pretty much any foot and ankle case at our hospital and our sister hospital, whether it's with podiatry or with orthopedics. And we share those experiences, which is really nice. We're very close with our vascular surgeons, so our residents spend a lot of time with them, and we get a lot of hands-on experience from them as well. And then when they're on just our service, our podiatry service, then as a first year, you're doing a lot of the inpatient caseload, always with the second and a third year backing you up. And then they're covering our wound care, our clinics, post-op clinics, and then surgery centers, inpatients, outpatients, all different campuses. So it's busy. It's busy in a wonderful way. And when we have the opportunity for the residents to double scrub and assist, we do that. And when we don't, they spread those opportunities out a little bit more. So.
That's awesome. One of the questions I get a lot from students is call. What does the call schedule kind of look like over those 3 years? Is it heavy in the first year and lightens as it goes, or what's the kind of?
No, we have a tiered structure. So there's always a first, a second, and a third year on call together. So, the first, I would say 4 months, the first and second year, they're like a buddy system. They're really working together. So it's not like the residents show up on July 1st and we throw them in the fire and say, have at it, see this consult and call us when you're done. They're there with the upper year. So they're training them. The second years love the teaching aspect of it. I think they learn a lot from teaching. Yeah. They also realize how much they learned, as a first year resident. And then the third year is always there to assist if things get really busy, for traumas, for anything that might need a higher level of supervision. And of course, we always have, an attending around. There's always an attending on campus as well. So it does taper off in terms of how much, I would say, that the amount of time you're spending on inpatient care as you go through your years, but that role changes, and it changes in that supervision level and the teaching level, and really there's a lot of teamwork involved. It's been really great to see over the past few years our residents, just pitching in, noticing, hey, this, I just saw these 5 consults showed up at the same time. I'm going to jump down and see something for you, for you in the ER, even if they're not on call. And seeing a lot of that teamwork and camaraderie has been really awesome.
That is great. And especially, it's funny, right? We've talked about the ability to function in a team. And medicine is such a team sport, right? To do it well, being able to have those soft skills is such a valuable thing, and knowing when to be helpful and how to be helpful and how do you communicate with your team. And so that sounds like an amazing opportunity to have multiple opportunities for the residents to interact with each other, interact with other specialties, and really get a nice, well-rounded experience, which is great. When you talk about research, the fact that you have a department that helps with facilitate some of those things like the IRB and those things. Yeah. Is research something that they are required to do for graduation, or is it just supported?
Is a requirement, but we give dedicated time. So each resident gets a total of 2 weeks throughout each PGY. One is one cohesive week that they're kind of set aside, and then the other is longitudinal throughout the year. So they get the time and they get the support. And I like to think that we make it less intimidating. A lot of people hear research and they think, I don't know how to do that. I don't know where to start. I don't have an idea. And we try to make it as, laid back and easygoing as possible. We start off with a brainstorming meeting in usually around August with the first years, just to say, just bring some things you like some topics, and then we'll all sit together and see if we can come up with a research idea about that topic. Always encouraging them to pick something that they're passionate about, because they're going to be spending a good amount of time with it. So there is a requirement for them. But again, they get the time to work on it, and they certainly get the support from the department. And they're always paired up with an attending mentor, that's working directly hand in hand with them on those projects.
That's awesome.
Ellie, I have a question for you. When you're looking at prospective residents, when they come through as clerks or they apply and interview, if they have a research background, are they looked at favorably?
Absolutely. I think that, and for a variety of reasons. One is it shows they're getting involved in their profession and involved in their school and their community. Sometimes it can show us, a particular interest that they might have within podiatry, but it's by no means a requirement. So I don't ever want to discourage people from applying to a clerkship or for an interview because they don't have that experience. So it's definitely looked upon favorably, but certainly not a requirement.
That makes sense. We try to introduce our students to research, and we, in a similar vein, we have student-initiated research because if they're passionate about it, they are more likely to carry it out. But I think in the last 3 years, we've had 54 students involved, and I always encourage them because that does look good on paper. Because I used to be involved in a residency program in Colorado too, and we really looked favorably upon that. So that's great. Yeah. Joe, if you don't mind me asking another question here, with that in mind, can we talk about student clerkship rotations for your program? So what does that look like? Do you have requirements to become a clerk from a grade point or GPA or class rank? And then what's the month look like when they come to Geisinger?
Sure. So I don't have a black and white GPA cutoff. So similar to just because you don't have research, doesn't mean don't apply. And just because you have a lower GPA or may have something in your application that is stronger or weaker, please still apply. That being said, we look at all of those things when we're choosing our clerkships. And we also look at those things when we're determining priority of who gets their first choice in their months and things like that. But we try to accommodate as many students as possible. We do take some core students from certain schools that have core. We have one right now, which has been a really awesome experience. And there's months where we have 4 students. That's the most that we'll take in 1 month. So it ranges somewhere between 2 to 4 every month during that busy season. And their day-to-day is, we try to make sure that they get immersed in the experience while they're with us. So we want them to spend time with different attendings. We want them to at least, see the surgery center, be there once or twice. They're always at our weekly academics every week. We try to prioritize cases that maybe have a higher complexity, maybe things that they haven't seen before. They are required to give an end of month presentation, and we do that during our academic session. And they typically will present an article during our journal club, and that also occurs once a month. And we also have them take a weekend of call. It's not in-house, it's from home, and the residents don't call them if it's, a less complex consult in the middle of the night. But if there's a trauma or something exciting, they'll call them and they'll come in and they'll scrub and get their hands on. I'm proud to say that we've received a lot of accolades from students and appreciation in terms of the amount of hands-on that they get at our program. So we really try to let the students get their hands wet and get some of that experience. It seems like they're not getting a lot of that, perhaps at other clerkships. So that's something that we've really tried to make a priority over the past, certainly the past couple of years as well.
That's wonderful.
That is wonderful. One more question. Students always come to Joe, and they're in my office and Joe's office and our other faculty, and they want to know questions like, do they provide food when I go there? Do they provide housing? And of course, you know how expensive it is the 4th year doing clerkships. What is that environment like?
So we do provide housing, but they do have to contribute a stipend towards that housing. So it's not free, but it's certainly not as expensive as if they were going out and getting that housing on their own. It's very close to the hospital. It's, walkable on a nice day, but they do need a car when they come. Our public transportation system is not great in our area. Meals they are responsible for, aside from any sort of, academic events or things that we might have communal meals for everybody. Or if we, everybody wins a free coffee if they put this external fixture on the quickest on our Sawbones workshop or something fun like that we tend to do during academics.
Fantastic. Well, I'm sure you'll be getting some Arizona students applying and coming out.
We would love that. Thank you.
Go ahead, Joe.
All right. So I'm going to kind of switch our focus a little bit. Tell us a little bit about your personal experience in podiatry. What was it that got you interested? How did you find podiatry? Did you always want to be a podiatrist? What was that journey like for you?
So my journey started around high school, and I did ballet. I was a dancer, and I can't say I had one life-changing injury. I just had a multitude of small, minor ailments, and that is what initially exposed me to podiatry. Simultaneous to that, I wanted to pursue a career in medicine, and I thought I wanted to be a surgeon at the time. Why? I don't know. No one in my family was in medicine, but I started to shadow a podiatrist. I also thought at that, young, naive age of 15 or 16 years old that I wanted to have a family someday. And so even at that time, I was thinking, well, is that doable? Can you be a surgeon and have a family? And so I chose a female podiatrist that had 2 children who was a surgeon to shadow. And I spent quite a bit of time with her in high school. And she did it. She had 1 day a week in the operating room. And there were days that she altered her office hours to be able to pick her kids up from school. And I can remember being in her office and having patients come in and saying and knowing her children by name and asking specifically, how did their soccer game go last week? And she'd ask about their granddaughter's wedding. And I just sat there and thought, this is amazing. This is really cool that you can develop this type of relationship with patients that is so meaningful. And so, that's really where it started, was at that high school level. Fast forward to when I was in college, I did the pre-med track, and I was fortunate enough to participate in Temple's summer internship program. So I did that the summer between my junior and senior year, and it was like a week of podiatry boot camp, I guess. It was just so cool. We got to observe surgeries. We were in the clinic. We put casts on. They did a really nice job of just exposing us to all different elements of podiatry, and that really is what sealed the deal for me ultimately. I think was that experience. I was already in that mentality and on that track that's what I wanted to do. But then kind of getting that exposure for that week and being able to see, really, and what life would be like as a podiatry student was really amazing.
How did you find out about that program?
That program, I believe they did some outreach to our college at the time. I also, like I said, I was interested in podiatry, and I knew that Philadelphia is about 2 hours away from the area that I practice in now and the area that I grew up in. So from a geographic standpoint, I think I had my eye on the Philadelphia and the New York schools. And so I think between, college outreach, me looking into that school in and of itself, somehow the stars aligned and I applied and was able to get that experience.
That's awesome. So I want to piggyback on something that you had said, because I know you're also a mother. Recently even just had a baby several months ago. So what has that kind of looked like for you in your practice? Again, you're the residency director. It's not just not to downplay the importance of being an attending in a program or being in a high volume facility, but then also being a director is a whole nother level of responsibility. Can you talk a little bit for some of our audience about how we manage life as a mom, as a director, as a physician, surgeon? What does that look like for you?
Well, I like to call it a beautiful chaos because it is certainly chaos. But you have to find the joy and the beauty in that and let go of trying to keep everything afloat at the same time, because there's always an up and a down at work, at home, and with myself. So I think that, actually being in academics has given some flexibility to my work schedule that has allowed me to be a better, be there for my kids more. So, there's a lot of residency work that just needs to get done, and it doesn't necessarily need to get done at 8 a.m. on Friday morning. So if I can take my child to a doctor's appointment or be there for something and do some of that work at a different time of day, that's been really helpful for me. I have, learned to try to prioritize myself in all of this beautiful chaos, because I think without doing that, none of those other balls are going to stay up. Right. So, I exercise every morning before anybody in the household wakes up. It's my quiet time, and have my coffee. It's that time for me to reset. It's that time for me to get out of my own head, and kind of invigorates me from a day-to-day basis. I still do ballet. I know we talked about that. It was kind of something that brought me to the profession, and I'm really proud to say that it's something that I still do once a week, and I enjoy it tremendously. Even now, and maybe even more now. And so trying to prioritize myself, and it's never perfect, and it's never, always ideal. There's always days or weeks where, things might be great in one arena and not so great in another arena. But I think that trying to just understand that that's always going to be the reality, and that's never going to, all fall perfectly on a daily basis has allowed me to, process it and try to enjoy some of the day-to-day and smaller moments, because those are the important ones, especially with your children.
Yeah, absolutely. I know you and I have talked a little bit like this idea. I dislike the term work-life balance. I think that implicitly implies that if one thing is up, something else has to be down. And that's just not really the case, or this idea that if you're doing 80% somewhere, that means something else is only 20%. And that just isn't necessarily how it goes. And I feel like when we wrap our head around it in that kind of framework, it actually limits rather than helps us. And it's more like a work-life flow, right? Like everything is a trade-off. And that doesn't mean they're bad trade-offs. It just means what are you willing to accept as a trade-off at this stage? And I love your comment there about the flexibility is just because, somebody had at the bottom of their email, my working hours are not your working hours. So don't feel, like you have to reply. And I think that's something, maybe COVID, good things that came out of COVID is we all started to realize that you get your work done when you, in your world, in the way that you can do it, and fit family in there where you can fit it. And so having to kind of squeeze things into these little boxes of parameters just isn't necessary. And alleviating some of that pressure that we kind of put on ourselves is useful. And talking about it more in terms of an ebb and flow, that, like you said, there's going to be highs and kind of lows, and that's just a normal, natural progression. It's not necessarily that it's a bad thing. So I love that. I think that was very insightful.
Thank you. I think learning to say no too has been really important to me. I think that, and there's a time for that. I think coming out early on in practice, you want to say yes, right, to most work opportunities, be it a patient, be it adding another patient to your schedule, or a surgery, or a committee, or a presentation. So, I said yes to everything. And I'm glad that I did then. But there becomes a point in time where you can't keep saying yes to everything. It's just impossible. So then I tried to sit back and think, well, what are the things that really bring me joy and fulfillment and contribute in a meaningful way, to my community, to the profession, to our residency program, and trying to sift through that. I still have a hard time with it. I do, if I can't, make something work, but that's been a journey. And I think that it can be, though, liberating to realize you don't have to do everything, when you get to this certain point. And some of that's in my personal life as well. It's not all just at work, but it's impossible to do it all and to say yes to everything that's asked of you.
Yeah. This idea that, we only have so much time, energy, attention, and focus. And so figuring out where you want to channel those things. And then every yes is inherently a no to something else. So being very selective, right, about the yeses, and very intentional about the nos. And I just read a quote this morning that is going to be my new quote for the year. And it was, you're not truly focused unless you sometimes mourn the things that you're saying no to. And I'm like, oh man, like, because at some point too, you just want to say yes to things, not because you want to add more to your plate, but because you just start getting really interesting opportunities that you want to do. But in order to do them and to do them justice, you can't. So something, again, trying to figure out what are the things that I'm going to say, what are the priorities that I'm going to say yes to, and the things that don't meet those criteria, you're going to mourn the loss of those things, but otherwise there's no way to stay focused. And so that you just totally reminded me of that. And I'd like to piggyback that onto my next kind of question for you. I know you do a lot with the American Board of Foot and Ankle Surgery board prep. And again, a lot of our listeners they stress out about boards and getting ready for boards and wanting to prepare for that. Can you talk a little bit about your experiences with the board prep and the courses, some of the services that are provided?
Sure. So for about 6 years, I've been affiliated with some of the ACFAS committees, very specific to board preparation. And I think that my biggest recommendation to any residents or post-residency that are looking for board preparation material and what to do and how to study is to use the resources on the website. I really think there's a lot of good stuff on there. We're always trying to make it better, and we're, certainly not. We could revamp, different things here and there, but there's a lot of great stuff that's available. Practice questions, tutorials. Information on the material. We've added a lot of rationales to all the practice questions. So now when the residents or attendings take these questions, not only do they see what's right and what's wrong, but there'll be an explanation about why a specific answer that was chosen is right or wrong. And there's a reference to that question and where that answer came from, so they can, see what kind of references are used. So there's a lot of great information that's there and that's available that can really be beneficial for the test taker.
That's awesome. I don't know if Jeff, if you had any other question that you wanted to take all the...
I also think that's incredible. Something crossed my mind. I heard a doctor recently reference work-life balance as work-life harmony, and that kind of sounds like you two have kind of put that together. So congratulations to you.
I like that phrase. I might steal that one.
It's Luke Ciccinelli's phrase. It's not mine.
Okay.
That's a great one, because I just don't like the word balance, but harmony, that strikes the right chord, no pun intended.
Absolutely. Ellie, how old are your children?
6, 4, and 7 months.
Oh my gosh, how fun. Busy times for sure.
Yeah. All girls.
All girls. Very good. So I have a question. How did you transition into being the program director for the residency program?
When I started my job with the hospital system about 10 years ago, within the first year, I became the associate program director. So, and that was a natural transition for me. I love teaching. I've taught my whole life in different capacities. I taught swim lessons when I was a lifeguard in high school, and I taught dance lessons, and I tutored in podiatry school and did the cadaver lab, a lot of tutoring with that. So I've always been a teacher in some form, and I've always really enjoyed that. And so that's what started my journey. And I did that for about 4 or 5 years. And then I transitioned to the role of program director about 5 years ago.
Fantastic. That's just another role in academics, which is so crucial to the advancement of our profession. So my hat's off to you for that. Thank you.
Thanks.
So probably the final question that I would have for you, Ellie, is what kind of advice would you give a prospective student or current student in terms of, we'll start with prospective. What kind of advice would you give them as they're looking at different opportunities and careers? Maybe what you think are some of the benefits of podiatry? And then similar question for current students, what are some of the things they can do to be a great resident? Because that's another question how do I be a great student? And then how do I be a great resident?
Yeah. So we'll start with the prospective student. So, I'll start by just reemphasizing how wonderful I think our profession is, how, when I was in high school, I saw this connection that this podiatrist that I shadowed was able to develop with her patients, and I have that now with my patients, which is so wonderful. It's they ask for pictures of my kids every time I walk in the room, and so sometimes maybe they're not the most complex patients on my schedule, but oftentimes they're my favorite. They fill up my cup, especially when I might just come out of a room where a patient's complaining of pain or swelling. I think our profession provides the ability to choose, how you want to create your career path. You don't have to be a surgeon, or you could be a surgeon. You can treat pediatrics or geriatrics. You can do dermatology. You can do sports medicine. There's so many avenues and so many pathways within our profession. And I do think that our profession can give the opportunity for a good, we'll say, work-life harmony. I do take a lot of call, and my life is busier, and my work hours are definitely more than what I expected when I was 15, but there still is a lot of flexibility in how we can shape our careers. And even if you want to do surgery, you don't have to do everything that you're trained in. You can decide on something that you really love and want to focus on. So I would encourage those prospective students to shadow, get out and get some exposure, see if you like it. And I think you probably will. I think it's a wonderful career. It's served me very well for the past 10 years. And I think that it's an exciting time, and I would just encourage them to try to see it for themselves. For the current students, then, to segue into the second part of the question, my first piece of advice, and something that I wish I had done differently or did more of, was to ask more questions. I think, looking back when I was a student, I was afraid to ask questions. I was afraid because I thought maybe I would be embarrassed, or that, whoever I was asking them to might think that answer was obvious, or that it was a stupid question. And I try to tell our students and our residents day after day, there is no such thing as a stupid question. And that, as the program director, when we have rotating students, it shows me that they're thinking about what's going on, that they have an appreciation. I don't expect them to know everything. We're there to teach them, and residency is there to teach them. But hearing them ask thoughtful questions and shows me that they're paying attention, that they're considering what's going into a workup or a surgery or a diagnosis. So that's something that I wish I did more of when I was going through my training. And aside from that, I would say be respectful, be a team player, be on time. Again, all of that sometimes is more important than, knowing the answer to a test question.
Well, that is so true. I have a question, one more question for me, Ellie. So a lot of students ask me, I'm interviewing for this residency program. How do they decide who they're going to pick and how they rank them? So this is kind of like looking behind the curtain a little bit, right? How do you do that at Geisinger? Who gets input, and how do you evaluate them? Do you have a rubric, or how does that work?
Very timely question, because we are getting ready for our travel to CRIP. We leave next week, and we just brought this up this morning in our academic session with our residents. So our feedback process is multifaceted. We have a team that's half attendings, half residents, that is physically going to Texas for CRIP. But we also are going to have a session next week before we leave, where every resident gets to give their feedback from experience during clerkship, their feedback maybe just from knowing a resident from school, a student from their school, or in whatever capacity that they would like, so that everybody has an input. And then they'll actually give us their resident ranking of what they would choose. And we take that really into consideration strongly when we're coming up with our attending rank. And then, of course, then our team will come back, and we each kind of weight different candidates differently, and then we combine all of that feedback together to come up with our final list. But the resident feedback is really important to us. as the director, I'll see the students almost every day or at least a few days a week, but I still don't spend as much time with them as the residents do. And they sometimes see a different perspective. They see a different personality, a different work ethic, and sometimes can bring different feedback to the table that the faculty don't always see. So that's really important to us.
That makes sense. We do the same thing at the school. We've got student ambassadors that spend more time with the applicants than the faculty does, and we value their input also. So that makes sense. And I'm sure it results in great options for wonderful residents. Well, I don't have any other questions. Joe, do you?
No, thank you so much for taking the time to come on and kind of share your perspective and talk about the program. Because again, students constantly want more and more information. And so it's great for them to get to kind of hear it, not just from Jeff and I, but from programs directly. So thank you so much for your time.
You're welcome. Today. We do have a residency program social media page. So I know that's a way that prospective students these days oftentimes get information about their program or prospective programs. So please, follow our program it's at Geisinger_podiatry. Awesome. They can get more information on our day-to-day.
Fantastic. Ellie, it sure was a pleasure meeting you. And I want to, again, reiterate what Joe said. Thank you so much for making time. I know how busy you are, especially with the 3 little ones and the program. We do have a Dean's Chat cup for you. So in those early mornings, you can drink coffee when you're working out. And we'll send that to you. And then to all of our listeners out there, if you're listening on Spotify or Apple Podcasts, please give us a 5-star rating. And of course, if you're watching on YouTube, we'd love for you to become a subscriber. Ellie, thanks again. Joe, thanks again. Cheers, everyone.
Thank you. Cheers. Thank you.